Niacin's evolving role as a selective modulator of liver X receptor alpha LXRA introduces an important therapeutic distinction, one that separates it from synthetic LXR agonists that, while effective at promoting cholesterol efflux, are often limited by their prolipogenic side effects in the liver. Synthetic LXR agonists stimulate reverse cholesterol transport by upregulating genes like ABCA1, ABCG1, and NPC1, but they also trigger hepatic fatty acid synthesis through activation of sterol regulatory element binding protein, 1C, SREP1C, leading to undesirable outcomes such as hepatic steatosis and hypertriglyceridemia. Niacin, in contrast, appears to activate LXRA in a tissue-selective manner, enhancing cholesterol clearance in macrophages without promoting hepatic lipogenesis. This selective activation makes niacin a particularly attractive candidate for safe and targeted intervention in atherosclerosis. Within macrophages, niacin upregulates LXRA through a calcium-dependent mechanism. Upon entering the cell, niacin stimulates CD38, which catalyzes the formation of nicotinic acid adenine dinucleotide phosphate, NAP. NAP triggers calcium release from lysosomes via TRPML1 channels, and this localized calcium signaling cascade activates LXRA. Activated LXRA then induces the expression of key genes involved in cholesterol efflux, namely Niemann-Pick C1 and PC1, ADP binding cassette transporter A1, ABCA1, and G1, ABCG1. This mechanism enhances lysosomal cholesterol egress and promotes reverse cholesterol transport, RCT, out of foam cells, thereby reducing inflammation and plaque burden. Critically, this LXRA activation appears to be context-specific. Niacin's effects were observed predominantly in macrophages loaded with oxidized LDL, with no significant evidence of systemic lipid accumulation or increased liver triglycerides in the animal models studied. Unlike synthetic LXR agonists that distribute broadly and activate lipogenic genes in hepatocytes, niacin's action is restricted by both its pharmacokinetics and the need for CD38, NAP signaling, a pathway not equally active in all tissues. This selective engagement may explain why niacin can activate LXRA in macrophages without triggering SREP1C driven fatty acid synthesis in the liver. This selectivity has enormous therapeutic implications. One of the major roadblocks in the clinical development of potent LXR agonists has been the risk of hepatic steatosis. While these drugs excel at promoting cholesterol efflux, their inability to avoid liver fat accumulation has made them unsuitable for long-term use, particularly in patients already prone to metabolic syndrome or non-alcoholic fatty liver disease, NAFLD. Niacin circumvents this problem by focusing LXRA activation where it matters most, inside the inflamed, lipid-laden macrophages that contribute directly to plaque formation and instability. Moreover, niacin's ability to reduce IL-1 secretion and foam cell apoptosis further enhances its therapeutic profile. By engaging LXRA in immune cells rather than hepatocytes, niacin provides dual benefit, promoting cholesterol detoxification while suppressing inflammation. This is a rare combination among current lipid-modulating therapies and positions niacin as a more holistic tool in atherosclerosis management. In summary, niacin acts as a natural, macrophage-specific LXRA agonist that activates cholesterol-clearing pathways without provoking hepatic lipid synthesis. This selective action offers a safer, more targeted alternative to synthetic LXR modulators, allowing clinicians to harness the powerful anti-atherosclerotic effects of LXR activation without compromising liver health. As our understanding of tissue-specific nuclear receptor signaling deepens, niacin stands out as a model for how metabolic therapies can be both effective and organ-selective.